The head of a Ministry of Health Ethics Committee is calling for the immediate destruction of hundreds of suicide notes submitted to an allegedly bogus study backed by comedian Mike King's Key to Life mental health charity. The 1,000 Letters study launched in September and asked people to submit final notes or messages left by victims of suicide so that they could be analysed for common themes to inform future interventions and suicide prevention efforts. Last month, the Ministry of Health wrote to the Trust asking it to stop collecting letters immediately because it doesn't have Ethics Committee approval and there are privacy and safety concerns. But Mike King is refusing to stop the research. I asked the Chair of the Ministry's Ethics Committee, Kate O'Connor, what her main concern was with the Key to Life's 1,000 Letters campaign.
Potentially someone who was troubled by suicidal thoughts and behaviours could be triggered by having to remember their thoughts and feelings. Persons who had survived a suicide attempt were invited to submit their memories of what they had been going through at the time, and certainly the expert opinion that was within the formal complaint was that this could be very triggering.
So when you say you got lots of complaints, from who generally? Are these professionals? Professionals or family members or?
There were a range of people. There were clinical experts that gave us a formal complaint, and numerous emails and letters from people with lived experience of suicide, people who had been bereaved, people who had survived their own suicide attempt, and consumer advocates and people working in mental health.
So the Ethics Committee wrote to Mike King's charity, the Key to Life Trust, and what were you asking of them? What did you want?
Well, initially we wanted them to postpone the research, the data collection, in the meantime until we had an opportunity to receive information about what their thinking had been in the research design and what processes they had in place to protect potentially vulnerable participants.
And to the best of your knowledge, have they suspended the collection of those letters?
I believe the website has closed down for now, but I believe that they are still intending to analyse the letters that they have received in order to inform their own internal strategies for suicide prevention.
Because when we asked Mike King on this program whether he would adhere to the request, he said, and I'm quoting him here, "Hell no, this isn't North Korea. They aren't Donald Trump. They can't tell people what to do." What is your response to that?
Well, we have ethics committees in this country for a reason, Lisa, a really good reason, and that's because poorly considered research can kill people.
Is it research? Is it a study? Because that is the other issue that has been raised. If they choose not to publish it, is it still research?
Yes, I think it is research. I think at the very simplest level, research involves analysing data to create new knowledge or create a deeper understanding of a problem. So that's exactly what they intend to do here, is to analyse the content of suicide letters for common themes, for example. So yes, in our opinion, it is health research.
So they didn't get back to you by the deadline. You wrote to them again. And so where are you at now? Have they allayed your concerns? Have they come back with a protocol for the study? Do they have someone overseeing it? Have they met all the criteria that you laid out?
We received a response at the end of last week confirming that the project was ongoing, but in their view it didn't meet the threshold for review by an ethics committee.
And what do you think?
Well, I think calling it a project is simply wordplay. Research, inquiry, investigation project, those words are interchangeable. They have collected data for the purposes of analysing them. So no, our concerns are not allayed, and we'll be passing our decision that there appears to be health research ongoing without ethics approval onto responsible authorities, such as the Health and Disability Commissioner and the Office of the Privacy Commissioner.
Do you think this is dangerous, what they're doing, as it is now?
I absolutely do. Yes, I absolutely do. I think they're very vulnerable people.
They have also told us that they're keeping these letters under lock and key, to use their words. Is that sufficient in terms of security?
It would be the barest minimum.
So what should happen with these letters that have been turned over?
Well, I think they represent research data that has been collected without approval or a properly informed consent, and as such, I believe they should be destroyed.
You think they should be destroyed?
Well, it's data that was collected unethically. So to use it for a purpose, and we're not saying that there isn't value in these letters. We're saying the context under which the data was collected appears to be poorly considered.
So are these letters in the wrong hands?
Well, they're not in the hands, as far as we can tell, of properly credentialed researchers.
Some of the people at the Trust are qualified medical specialists. Does that change the situation?
Well, I think their first duty is to do no harm, and I'm not sure that that they have thoroughly allayed many people's concerns that this research won't do tremendous harm. And that's something they do need to think about, I think.
So you are referring this matter, you say, to professional bodies. Does that then mean that potentially medical professionals who are involved in this are jeopardising their credentials?
Certainly, I think their bodies, such as the College of Psychiatrists, may have an interest in this matter, yes.
So exactly who are you referring it on to? Which agencies will you forward your concerns and complaint to?
Certainly the Health and Disability Commissioner, the Office of the Privacy Commissioner, and the Ministry of Health will consider which other agencies may also have an interest in this matter.
So that will mean going to registration boards for various specialties then, potentially?
Yes, potentially, that's right.
If this continues then, without meeting the requirements that you have laid out and asked for in your correspondence, does that mean that any results from this research or study have no value without these approvals?
Without the approvals, yes, it is. It would be valid to say that, but we simply don't know what their research design is, how they are going to make valid findings based on what is likely not a representative sample of suicides in this country. So I would suggest that it has pretty limited value.
So Mike King, having discussed this with him, he's raised a number of points, and I suppose it would be fair in summary to say he puts it like this, that the establishment, meaning the ministry and other groups that are funded for mental health work, they don't like it when other people come into their territory, and they don't like it when other people shake things up. He accuses the ministry of sitting on its chuff instead of trying new ways of doing things. So is he right, and are you just honing in on him because he's doing things a little differently?
No, not at all. I mean, the value of research to this country is enormous in terms of having evidence-based conclusions that are valid. So it's impossible for any agency to base decisions on simple guesswork or on invalid research results.
And that is Kate O'Connor, who's the chair of the Ministry's Ethics Committee there. Now, Checkpoint has contacted the Key to Life Trust about its 1,000 Letters project. It has responded with no comment.